Oral head and neck cancer. What is it? How is it diagnosed? And how is it treated? Our topic on this morning's edition of the Bronson Health Chat here on WKZO. We're joined by Dr. Zachary White. Dr. White is an ear, nose, and throat or otolaryngologist at Bronson Otolaryngology, head and neck surgery specialist in Kalamazoo and Battle Creek. Dr. White, good morning.
Good morning. How are you?
Doing fine. Thank you so much for joining us. What exactly are head and neck cancers?
Well, any number of cancers can form in the nose, mouth, throat, or even the skin of the head and neck are what's considered a head and neck cancer. These can include cancers of the mouth, the tongue, the throat, or specifically the larynx, which is located at the top of your windpipe or your trachea. And cancers of the sinuses, the salivary glands, the mouth, and the tonsils are also types of head and neck cancers.
Are these cancers common?
It depends on the type. Some cancers, like cancers of the mouth, are much more common. In fact, oral cancer is the ninth most common cancer among men. Others are more rare, like cancer of the tonsils or throat. But just because they are more rare and symptoms can generally be blamed for other conditions, these more rare cancers can go undiagnosed until they're in later stages and can be more serious. The most common type of cancer, accounting for about 90% of head and neck cancers, is a cell type called squamous cell carcinoma. That's because these squamous cells are so numerous, lining the nose, the mouth, the throat, and the skin.
Dr. White, what are some of the symptoms of head and neck cancers?
There's a wide variety of symptoms, and some symptoms include a lump in the nose, the mouth, the throat, or the neck, such as a neck mass. Another symptom could be a sore throat that doesn't go away. Others are difficulty swallowing, persistent coughing, ongoing hoarseness or changing voice, occasionally headaches, but that's sometimes can be due to a number of different things. Ear pain, hearing issues, congestion that doesn't go away, nosebleeds, trouble breathing, and as always, unexpected weight loss. And finally, any sort of mass or growth on the face and or neck.
We're talking with Dr. Zachary White from Bronson Head and Neck Surgery Specialist in Kalamazoo and Battle Creek on our Bronson Health Chat for this week. What are the causes of head and neck cancers?
There are a number of different causes. Tobacco use, of course, is at the top of the list. Whether smoking or chewing tobacco is a risk factor for head and neck cancer. Alcohol use is another factor, and these two in combination can kind of help each other along and can be a double risk factor. Human papillomavirus or HPV is also a risk factor in some head and neck cancers, such as certain types of throat cancers. There are other viruses that can play a part in development of head and neck cancers as well.
How are these cancers diagnosed and how are they treated?
So diagnosis usually begins with a visit to your doctor. This includes a physical exam and lab testing. If they are suspicious, they would refer to an ENT such as myself, and we would, perform a further physical exam, including endoscopy, which is a flexible tube that can give us a good view of your nose and your throat. If there is concern, a biopsy would be the next step after that, and there are other tests such as X-rays, ultrasounds, CT, and MRI that we use as we feel they're indicated. As far as the treatments, it really depends on the type and severity of cancer. Some cancers, surgery is the first-line treatment, and some cancers use chemotherapy and radiation, and other cancers use all of those modalities combined, depending on the type of cancer and the severity.
When should someone be concerned, and what should they do if they suspect they have an issue like this?
With head and neck cancers, you're the first line in diagnosis, the patient. As I mentioned, some symptoms can easily be ignored and attributed to something else. But pay attention to if you feel that something isn't right, that something is different, and have that conversation with your primary care doctor. Together, you track the signs and symptoms, and that gives an idea if there's something that should further be investigated. And again, at that point, you may be referred to an ENT such as myself to figure out what's going on with these worrisome symptoms.
And for further information on this, where can people turn?
Going to the Bronson webpage is a great start, and talking with your primary care doctor as well.
We've been talking with Dr. Zachary White. Dr. White is an ear, nose, and throat or otolaryngologist at Bronson Otolaryngology, head and neck surgery specialist in Kalamazoo and Battle Creek on this week's Bronson Health Chat on WKZO. Doctor, thanks so much for your time. Very interesting discussion. I appreciate it.
Yeah, thank you for having me, and have a great week.